बिस्मिल्लाहिर्रहमानिर्रहीम। अस्सलाम वालेकुम फ्रेंड्स, उम्मीद करते हैं कि आप सब खैरियत से होंगे। फ्रेंड्स, आज के सेशन में हम डिस्कस करेंगे हाउ लॉन्ग डज इट टेक टू गेट कोरोना वायरस टेस्ट रिजल्ट्स। वीडियो की तरफ बढ़ने से पहले हमारी आपसे रिक्वेस्ट है कि हमारे चैनल को सब्सक्राइब कर दें। चलें आज के सेशन की तरफ बढ़ते हैं। यू शुड रिसीव योर टेस्ट रिजल्ट्स एज अर्ली एज 24 आवर्स आफ्टर सैंपल कलेक्शन, बट समटाइम्स इट कैन टेक अ फ्यू डेज डिपेंडिंग ऑन हाउ लॉन्ग इट टेक्स द सैंपल टू रीच द lab. How long do you test positive after having had COVID-19? Because the PCR test is so sensitive, it can detect every small amount of the virus material. This means that the test can continue to detect the fragments of SARS-CoV-2 virus even after you have recovered from COVID-19 and are no longer contagious. So you may continue to test positive if you have had the COVID-19 in the distinct past, even though you can't spread the SARS-CoV-2 virus or others. Prolonged infection in the immunocompromised individuals can occur where they shed infectious virus for months. Also, healthy people can become reinfected, and if you test positive for SARS-CoV-2 but you think you might have already recovered from COVID-19, please discuss with a healthcare provider. What's the difference between the PCR and antigen test for COVID-19? There are two types of the test for COVID-19, that is PCR test and the antigen test. Polymerase chain reaction. This test is for the presence of the actual virus and genetic material for or its fragment as it breaks down. PCR is the most reliable and accurate test for detecting the accurate active infection. PCR tests typically make hours to perform, but some are faster. Antigen test. This detects the bits of the protein on the surface of the virus called antigens. Antigen tests typically have only 15 to 30 minutes. Rapid antigen tests are most accurate, used within a few days of the start for your symptoms, which is then the largest units amount of the virus is present in your body. Which COVID test is more accurate? The antigen test is typically faster but is less sensitive than the PCR test. Because the antigen test is not as accurate as PCR, if an antigen test is negative, your health provider could request a PCR test to perform the negative antigen test result. How should I find out where to get the tested for COVID-19? If you have symptoms of the COVID-19 or were exposed to the people who have symptoms or have tested positive or may want to test, first talk with your healthcare provider. They will review your symptoms in the person or on the video appointment. ये था हमारा आज का सेशन। मिलते हैं नेक्स्ट वीडियो में। अल्लाह हाफिज़।